Hi guys, welcome back to another episode. It's another day on earth hosted by yours truly. If you're new here, thank you for stopping by, and if you're not new, oh my gosh, thank you for returning back. So today it's going to be all about preparing for MDCN. So now, if you don't know what MDCN is, it's the Medical and Dental Council of Nigeria. It's like an exam you take after you finish your 6 years of medical school. So before you start house job in Nigeria, you need to take this examination. And I'm just going to tell you guys, give you guys a rundown of just how I prepare for the exam and the tutorials I use and everything. So I graduated uni December 2023. I came back in January, and then I was looking for. Okay, so before I came back, I already had an idea of the tutorial I wanted to use to study for the exams because, mind you, every country has like a syllabus they need to cover. So I'll definitely advise you to take a tutorial for the country license exam you want to take, especially if it's Nigeria. So a friend of mine recommended Med Scholar Academy. It's in Abuja, so 100% would definitely recommend them. So after that, I signed up for the classes and everything. And you basically, honestly, just follow their scheme and follow their teaching methods, and you'll be fine. So the exam was supposed to be in June normally, but they moved it to November. So I definitely had not November, sorry, September. So I had ample amount of time to prepare for it. But it was, it was very nerve wracking. I was very nervous about preparing for it. But after writing the mocks and seeing that the mocks were going okay, I was like, okay, good. Inshallah it's going to be okay. So the exams, so now when it's time for the exams, first of all, you're going to have to need all your documents ready. Your degree certificate, you're going to need your birth certificate, your WIAC certificate, if you wrote WIAC, if you're Nigerian and you wrote WIAC in Nigeria, even if you're not Nigerian, but if you wrote WIAC in Nigeria. And you also, before even this, you're going to need something known as your EPIC. So you're going to get an EPIC, you're going to do something known as EPIC. A it's like a website that will verify your degree, and they'll give you like an ID. So just make sure you keep the identification card they give you. But honestly, the whole process is, if you follow it step by step, it really is, it's not something hard to do. It's something that you can easily do. And so then after that, this year the exam was in Ibadan. And honestly, what was my experience like? So I heard stories before of how the examiners can be quite intimidating and whatnot. And so even our teacher did tell us that you need to go into that exam with confidence, because you always have examiners that just want to nitpick at you. So basically the exam is a 2-day exam. So the first day you have your CBT, which is a multiple choice question. Is about 3 hours for 300 questions, and it covers internal medicine, pediatrics, obstetrics, gynecology, public health, community medicine. So that's basically the first day. So the second day of the exam is your clinical. It's a clinical exam. Is where you have stations of clerking, counseling, levels of prevention. You're going to do physical examination. You're going to also have writing stations. So basically, in my exam, we had a total of 10 stations. We had levels of prevention. At that time, in my exam, we had our own levels of prevention. Was for, I believe, monkeypox. If I'm not wrong. But I believe it was monkeypox, because honestly there was an outbreak. So make sure you always look for an outbreak. Was it monkeypox? Honestly, I'm so sorry, I literally can't remember. But always make sure that if there's an outbreak going on close to the time of your exam, look out for that, because the chances of that coming on your exam is very likely. And then we had the physical examination. Ours was thyroid examination and abdominal examination. So mind you, for MDCN, there are certain methods and ways they need you to carry out the examination. There are certain procedures, there are certain steps they need to take. Yes, it might be slightly different from the one you learned in your uni. So that's why I always recommend going for a tutorial. So like med scholar. So we had that, and then we also had the clerking. So clerking is basically taking a history from a patient. So the Nigerian way of clerking is very different from majority of how we were taught in uni. The Nigerian way is very extensive and quite detailed when it comes to asking questions. So you need to know how to ask the questions according to the Nigerian. Because, for example, now you're going to have to start with when did it start, how did it start, is it sudden or gradual, for how long has this been going on, has it increased or reduced during this length of time. So you're going to also talk about the past medical history. It's basically almost the same thing as what we learned in uni, but just a more detailed version, because here in Nigeria, diagnostics, not everyone can afford diagnostics yet. So the doctor needs to ask a lot of questions in order to reduce the costs for the patient. And then there's also something known as counseling. So counseling, you're basically going to tell the patient, counsel the patient, give the patient more details about a certain disease. Also, there's a format for you to learn that as well. And for us, for our year, we had a counseling for a sickle cell disease patient. So we're supposed to counsel the mom on her child's sickle cell disease, and then our clerking was for diabetes, if I'm not mistaken. And then we had other writing stations, and we also had to take to do a routine antenatal check for a woman who was pregnant. So we had that. So you just basically ask the woman certain questions throughout. It's honestly like I said, go for med scholar tutorial, and they will literally guide you on every single thing. There's nothing for you to be worried about. As long as you prepare and you work hard, you will pass, inshallah. Everything will be fine. So yeah, basically that's how the exam goes. So you have, honestly, the clinical exam only takes about each station is about 5 minutes, but when you're practicing in my tutorial, we used to practice with 3 minutes 30 seconds, just so you have extra time in case you're nervous that day or you miss out something. You have extra time to cover up, because let me tell you, fear and nervousness is just one of the greatest things you have to overcome for this exam. And what else can I add? Okay, so after you finish the exam, your results will be out within 24 hours. So I remember ours came out Fajr. It was literally so scary, but just pray and work hard and everything's going to be fine. And then alhamdulillah, I passed. And then after you do that, you're then just going to submit your documents to Epic again, but now it's going to be sent to Nigerian Medical Council. You could have actually done that before you pass your exam. It's not necessary that you have to do it once you pass your exam. No. So you then do that, and then you just wait for your induction date. And alhamdulillah, our induction was November 28th, which was a couple of days ago. So yeah, I just wanted to come up here and tell you guys just how MDCN is. And then after MDCN, you're then going to apply for house job and NYSC and the whole shebang. So yeah, guys, that's basically it. If you guys have any questions, be sure to leave it in the comment section. I will definitely try and answer any questions you have. So yeah, that's what I have for you guys today. Alright then, thank you. Bye.